All right, so we're moving on to the next complication in the brain. Now, this is what is known as what? Intracerebral what? Hemorrhage. Intracerebral hemorrhage. So intracerebral hemorrhage is just simple. Intra, inside, cerebral is the brain. So there's a bleeding that is going on, and this bleeding is going on in the brain. That's just what the intracerebral hemorrhage just is, So for this thing, it's just trying to talk about bleeding in the brain. So looking at the pathology, it's more of like you're trying to say, okay, how does this thing actually looks like, So intracerebral hemorrhage, you said it's a devastating type of stroke. It's caused by bleeding, and this bleeding is occurring directly into the brain parenchyma. Okay, so it accounts for about 10 to 15% of all strokes. It carries a high risk of mortality and long-term disability. Do you understand? So there's bleeding in the brain. Several parts of the brain are being affected. Do you understand? So the person can actually easily die from this. So etiology and risk factors is hypertension. That's like if you have hypertension, there's a more likelihood that you actually bleed from it. You understand that kind of thing. Cerebral amyloid angiopathy, vascular malformations, traumas, coagulopathies, then tumors. There's sometimes some side effects of some drugs that you use is what actually cause your blood vessels to kind of like burst off and all of that, So pathophysiology, what usually causes it is, yes, you are having all these issues, but intracerebral hemorrhage will not come in till there's now a bleeding. You understand? Then charcoal bouchard aneurysms, hematoma formations. There's sometimes secondary injury, okay, ischemia in surrounding tissues, edema, that's accumulation of fluid, risks of herniation syndromes. All right, so common sites for hemorrhage, it could be in the basal ganglia, it could be thalamus, could be lobar regions, could be the pons, could be cerebral. Now you could actually see the frequencies, like based on the percentages of the frequencies right there. And for each part of the brain that is affected, you actually have the clinical impact, right? So the clinical impacts are just there, motor deficit, sensory loss, variable symptoms, rapid coma, attacks. So it just depends on the type that is like affected, So physiological features, the brain parenchyma is disrupted, compressed ischemic zone around bleeding, cerebral edema develops over hours to days, vascular changes, there's lipohyalinosis, that's like accumulation of lipids in the blood vessels, definitely, fibrinous necrosis, microaneurysms. So clinical consequences, such a patient is having headaches, vomiting, focal deficits, decreased consciousness, risk of herniation due to mass effect, high mortality, especially with brain involvement. Okay, so guys, that's just it for this intracerebral hemorrhage.